Hello, Mia. I'm so excited to have you here and that you'll be commenting and talking about what is so important about the mouth health, oral health, dental health, and how it relates to bone health and how the osteoporosis drugs may impact bone health, osteonecrosis. So I'm going to ask you if you can introduce yourself and tell my audience who you are. I will say how delightful you are, but tell us who you are and how you came to the mouth.
Hello, Irma. Thank you for making this possible. I feel really honored and I must say comfortable. I'm a long-living plant with a few careers in my luggage. So my first half of life was pediatric dentistry and preventive dentistry, teaching and working and mentoring in university settings for almost 20 years, from early 90s to mid 2000, when I've decided to settle in Canada to live with my family in Montreal. And over here, I reached out for the preventive part of the dentistry, which is my real passion, and it's my life philosophy. And these are the guys. I mean, I don't want to really go into details, but they do use everything we eat. And more often we eat, more active they will be. And more active they are, the more acidic environment will reign in the mouth and will cause the teeth and the gums to react.
So the more often we eat,
Mhm.
because what I had heard you say previously, and I think that you're reiterating this point, is that we shouldn't be eating all day long. We should be eating 3 meals a day, 2 meals a day, or 3 meals.
Meals, yes. In general sense, I have to say, we eat more than we use. We take more energy than we use, but that's another story.
Another presentation. Okay.
However, it has direct implication in our oral environment, because for saliva, it takes a couple of hours again to take back the minerals. That's why we call buffer capacity. So saliva has little minerals in its content, like phosphates, bicarbonates, magnesium, calcium, copper, some trace elements. All of them are waiting for the acids to come in, and they're going to capture them, put them into salt in active state, and we're going to be happy. No acid, no caries, no problems, no inflammation, nothing happens. However, buffer capacity is what it says, buffer. You use it and it's gone, it's volume. So buffer capacity of an average saliva is 30 minutes. That's why I suggest you eat half an hour and you stop, because nothing is protecting you after that time.
So we shouldn't be European and eat for an hour and a half.
Well, I'm not sure that they are eating for an hour and a half, but
Right,
they're taking breaks, that's for sure.
Right. They're socializing. They're yes, absolutely.
Yes, I know. Of course, in that sense, that's for sure, you know. Or for example, I'm a big coffee drinker. I just love it. But I had to discipline myself to go under half an hour of sipping coffee, because it's acidic drink, so I really cannot risk my opening my wallet every time I go to the dentist. So that's it.
Okay. All right.
All
So
right.
as far as coffee is concerned, you're saying don't sip it throughout the day.
No, rather have three good coffees, and drink them while they're still warm, and then rinse mouth with water. Strategies, frequency, we know what it means. I like this rule of three meals per day. You're going to have dietitians who's going to tell you eat small meals like 5 to 6 times per day. That's also a little bit too demanding for the stomach to go with the preparation for digestion every 2 hours. It's a bit of a stretching for me. 30 minutes, we've mentioned that. 3 hours between meals, it corresponds to reset. Mindful eating is something that I find great pleasure in the last 5 years and more. When you're hungry and you prep your meal, or you buy something, or you get out with friends, go in a beautiful place, the first bite that you take when you're hungry is the most delicious of all.
It's true.
Take a second and think about the features of that deliciousness. Is it juicy, creamy, sweet and sour, warm, just perfect? And pay attention, when will be the next bite, or better said, the first bite that does not taste like that?
Right.
After 10 minutes, 15, then it's the time to stop eating. I guarantee you're going to be full. Colorful, it's always important. Yes.
I want to just speak to the mindful eating for a second. What I recommend to my clients is, before they take that first delicious bite, to actually take 3 deep breaths into the belly. And so to get the blood flow to the belly versus the extremities, which is in a fight or flight response, that the blood is going into the belly, getting ready for digestion. But to actually take that breath, and whether or not you say a prayer of gratitude before the meal, which
Always.
many people, it's tradition, or just taking a breath, because it's quite a delightful ritual that actually adds to the value of the consumption.
I absolutely agree. I absolutely agree. I'm more than beyond than grateful that we have food that we have.
Yes, yes,
It's
yes.
it's an absolute miracle. It's something I like to cook, I like to eat, and nothing I take for granted. We don't have wasted food at home. Everything is repurposed, redone. My kids used to joke with me, Mom, what is it today? Tour de frigidaire? So we usually do that. And colors, please, colors. I
Yes.
don't like beige puree and brown steak. It has to be, it has to be everything.
So in the bone world, it's recommended, and I talk about this with my patients, with my clients, excuse me, to drink lemon water,
Mhm. Okay.
and then to rinse their mouth out afterward.
That's right. Yes, yes, yes. We're going to see a bit later that all that is okay. I'm not advising against,
You're
but
talking about putting the wedge in. Yeah.
even the wedges, but the wedges, it's a bit of an extreme activity. I'm sure if we drink it all at once, it's going to have the same effect for bone health
Mhm.
as when we sip.
So it sets us up to become more alkaline. Now,
Yes, well, I have my own input into that because of the research I've been doing. Alkaline or acidic environment in our body, in our bloodstream, that's something interchangeable. It happens all the time to all of us during the day. Many times we change sides. The main thing is that if we limit our time of use, our mouth and our stomachs for feeding ourselves, we're going to do good. We're going to eat less, but also we're going to eat better food. And then we can give chance for saliva to come back to neutral levels, to replenish with minerals, because it does. And it will give time to the stomach to digest what we've taken. Remember, food is remaining in our stomachs for 2 to 3 hours. You cannot add more and more and more until that one is out.
So Mia, how do people get in touch with you?
So thank you for asking how people can best contact me. I think the email is the best mean because I'm really eager reader. I answer all my emails, and it's in the bottom of this page.